So crescent, we move to the next one, the crescent kicks. Okay, this is when you want to stretch adductors, abductors. Crescent is just to make, yes. As much as possible, not bend any.
Oh, okay.
Wait, which knee? Don't bend which knee?
The one that you're lifting.
Also.
Okay. Not that far out, but yeah, depending.
Wait.
This one is not that easy. Alright.
But you're bending. So
A
you
little
don't-
bit, yeah.
Oh, you could.
Depending on how.
Not like
the- But yeah, not like this.
No, because I went out because I didn't want to bend.
Oh,
No,
okay.
no.
But then you said don't bend. So
Bend
that's
a
why
little bit.
that's my out.
I think I was like,
He was like
that.
bending it.
So
And
like
so,
this?
yeah.
That's okay, yeah.
Okay.
But you
That's
don't-
why I went all the way out because I didn't bend it.
So you
Well,
go
those
from
really good
90
cigarettes.
45 degrees.
All three of
No,
us.
you go 45 degrees though. Not from the side. You're starting from here.
oh, okay.
Also not like knee.
Oh,
Okay,
that's.
so let's say move further back than each other.
Everybody
Alright.
starts creeping in.
From here. Okay, so only from here you end up here. Okay? So let's say 30 to 45 degrees here to here. And
My
then
hip abductors.
the other way. So
Wait. Say it again. Also, you stepped into it.
you step. Oh, I tend to do that because I'm used to it. But yeah, you can do that. Okay? And don't expect them to be able to do it high. Okay, hamstrings are
I
tight.
can do it already.
Okay, good for you. Yes. Don't swing it too much like that. Okay?
Okay, that makes.
Wait, I can't go as high then.
Not bad. Right, so those are the crescents.
I feel like
Adductors.
Yeah, I can't even do that, Aaron.
that was actually what I needed to kind of. Honestly, my husband.
Yeah, yes. It opens up the hip if you do the in-out crescent kick, or the outside crescent.
You could do it.
This is in, out, wait, out, in, out. Okay? Yep. Alright, so that will open up your hip, especially if you do in, out. And stretch your hamstrings at the same time.
After you stretch it, now you can go up.
Alright. Okay, now donkey kicks is, well, this is
Oh wait, we want to the doctor. Yeah,
okay.
when we did that one time.
loose, right?
Yeah.
Okay, terminal knee extension, which one are you talking about? Open chain, closed chain?
Both,
Because
because
it's
I
op-
guess that's yeah. So what's closed chain? I'm guessing is with when it's around there.
If it's closed chain, you're gonna be 30-degree bend, right? Let's say the band there, 30 degree, have them step, like, let's say the band is here, tell them to pull it, step back, 30-degree bend, and then lock it. 30-degree bend, lock it.
Also
that's-
not like
that's-
this. Like
I mean,
this.
I guess you can have it, I feel more comfortable doing it this
Okay,
way.
and that's closed chain.
Yeah.
That's closed chain.
Okay.
This is, stays put, that's, that.
Yeah, I feel
This
like
is
you're
open chain.
I feel like you're sturdier.
This is open chain.
Yeah.
This is closed chain.
Open chain, you need to use the wedge, the blue wedge.
Oh, is that?
They're in supine and then last 30 degrees.
That's kind of like the
We
Or
sometimes
with
use
the ball,
foam roller.
yeah, with the
Okay.
foam roller or with a bolster.
Yeah, like
Yes.
let's say you're on the bed and this is
Yes.
underneath your
Has to
knee.
be 30 degrees only,
But-
more or less.
Then it's gonna be like
Yes,
Okay.
that only. That's the open chain. Open chain's the end moves, closed chain the end doesn't move.
Oh, okay.
so like
Okay.
yeah, so like open chain,
Uh-huh.
closed
Closed
chain.
chain.
Oh, okay.
Right? You got that?
Locked in.
Can you
Okay.
show
I
me?
honestly thought that was a quad stretch.
No. It's a quad strengthening.
Okay, now I know.
Okay?
Kinesiology.
It says step up. What's a height comparison? What does it mean?
Oh, 6 and 8.
Yes, it says step up.
Oh yeah, height comparison. Wow, that was yours. No, that was
No,
yours.
not
No,
mine. That was yours.
that was mine.
What do you mean by step up height comparison? I mean step up is step up, step down.
Oh, the
No,
steps.
that was mine.
Oh, that was
The
yours.
step.
But it
Between,
wasn't height. It was
between
Like
what's
those.
the-
going up the stairs versus going doing
Yes.
exercises here.
Oh, okay.
height
So
comparison.
strengthening versus stability.
yeah.
So like good goes to heaven, bad goes to hell for stability, and then to strengthen.
No, actually not for stability. For if the good leg goes up, like good leg goes to heaven, bad leg goes to hell. Why do we do that? Because we're protecting the surgery.
Yeah, sorry, protect
Right.
surgery.
We're protecting the surgery. We don't want to do this movement, a loaded weight on it, and then you do a bend. That's not gonna be good.
So
So
steps are
Steps the exercise, you're strengthening the knee.
if you're strengthening the knee, then
So
you use
up
the-
with the bad, down with then the
Mhm.
Over there,
is
up with the
the
good,
bad. So it's
down
the
with the
same
bad.
thing.
No.
Mhm.
Like, so if let's say you're strengthening the leg,
Mhm.
you want to strengthen the right leg. The right leg goes up. It's using
This is the
for-
bad
yeah.
leg.
Yes, this is the bad leg. Bad leg is the right leg. Right leg is injured. So when you're going up, you're using force.
That's a bad leg.
Yeah, this is okay. Yeah, there we go.
Just say bad leg and good
Heart leg, the
Mhm.
heart leg. Okay, so when you're going up, it uses force to go up, it
Mhm.
strengthens it. As you're going down, it uses force to control going down,
Mhm.
it strengthens it. But that's too much for injured legs.
Mhm.
So that's why you want to avoid, like if this is too hurt, that they, like for example, like there's the weight bearing status, right?
Mhm.
Like they can't put weight on it. So what you're gonna do is when you're going up, you're gonna go up with a good, like, because you have a crutch, right? You have a crutch. You have a crutch.
Yep.
So as you're going, oh, actually, okay, there you go, thank you. As you're going up with a good leg, and you're going up here. There's no, like, force being generated on this leg. And then you're going up, and when you're going down, still no force being generated on that leg.
Okay.
So we see, if they
So
had,
Gabriel, right? That's his name.
we're
So
up
the
with
stairs,
good.
he goes up with the good.
Down with
Down.
the back.
Yes.
So then here with B step is down with, it's
With
up with
strengthening.
the bad, down with the good.
If
Yes.
you're strengthening it already. If you're doing this just to practice before going outside, it's still same thing. Up with the good, down with the bad.
Okay.
If you're gonna strengthen that leg already, then you reverse it. Okay? Because then you're working it.
But
And
actually,
that, this is strengthened, what is the actual?
that is just like if you have stairs
That's-
at home and you
that's
need to go
functional.
up and down
Yeah,
stairs.
that's functional, meaning you
That's
gotta go up and
okay.
down the steps.
Like pretend, like try it yourself.
I
okay?
want the,
Okay, so like pretend which leg? My right. Okay, so go up with your right. Like pretend, see you use a lot of force, so that's why you wouldn't want that. So go back down again. So go up with your left. And go up, all the way up. There we go. No force generated on the right, right? Go down with the left.
no, like,
The
my
bad
right
leg.
is the bad.
Yeah, so go down, go down with the right. Still no force generated, right?
Okay, I feel that
Everything's
now,
is-
I feel the difference.
Everything is in your
As long as you feel like, that's why it's like most exercises, try it out. Once you feel it, you'll get it.
So,
Mhm.
so up with the bad?
No, up with the good.
So
good.
technically, so you wouldn't have those there
Yeah.
if you're just start. So you start here because you can't go like this and
No,
then go like
It's
that.
too hard, yeah.
So you're here. Like I'll lift this leg up.
Yeah.
So I'm
Mhm.
here
Yeah, push it. Yes.
like that, and
Mhm.
then down with the good first.
Down with bad.
Yes.
Down with the bad first.
Mhm.
And then, so I didn't put this single foot down once.
So basically all the weight is going to the crutches?
Yes.
If it's
That's
a
why
non-
he was, like,
if it's
saying-
non-weight bearing. If it's
That's-
partial weight bearing, then it's.
Then you can like put a little weight on it or like
It has to be down.
so start
You
start
won't
down.
be able to push up if the curve is
Yeah, I
not.
have no, like, okay, so this is the bad.
That's why, like, as he was saying, like, when you're, yeah, there we go, so. There we go, and then, oops, crushes first,
Yeah,
down
yep.
there. That's why, as he was saying, like, when you're going down, it feels really scary, because you're putting your weight on your crutches. That means you're slightly leaning forward, which means you're gonna feel like you're gonna fall forward. You're not gonna fall forward, it's just gonna feel like that.
Okay, now that one though, if they're going forward and they feel like they're gonna fall forward,
Look at these
they-
crutches. Look at your okay.
but those are high though.
Those
But-
are too
but we
tall,
can
we're too
practice that,
short.
Yeah. But if they're coming down and they feel like they're gonna fall, that means they're leaning far forward.
They need to use the
You
leg
want
more.
to be able to just basically pushing down vertical. Because if you're leaning forward, you're gonna lose your balance and it's harder to push down. So you want to be close here so that when you're here, so basically you don't need to do this. This is hard. If you're just pushing here, it's easier. So you can actually just go like that. Okay? If you use crutches, they're a lot more
I
safer.
visualize it more because now I did that.
Yeah.
So
Yeah.
now I know like how to operate.
That's why you don't want them to do this, and then they're gonna do that.
Yeah, no.
That's why they feel like they're gonna go forward. If they're more like here, they won't feel like that because they're still.
Also, actually,
up more
closer
upright.
yung, ano,
They have to be, yeah, especially on the steps. So you don't want them on.
Oh, so he.
because I
Go
said
like this.
middle,
Yeah,
yeah, I
Because
said
if you get
middle.
like that, then he miss him. The momentum might carry him. So if
No,
it's
basically
closer,
asked, do I do it close, do I do
Good
medium?
far.
or
I said
far?
medium.
yeah, you go medium, but I would go closer because it's easier to do this.
So it's like right underneath
Yeah,
It's
you.
easier to do that.
Okay.
Alright? Okay. You can try. It's just it's easier to do that movement rather than to do this movement.
Yeah.
Big strength difference. Alright? So okay. So that's the step up, step down. You know why we're using the step up, step down already. For function and the other one is for strength. As patients will ask that.
So function is just like
Let's just get them-
class,
Get
When
them
you're
to
in a
be able to
class,
do it
like you're in a
safely.
brace,
Yeah.
surgery.
Because in rehab, they're gonna teach them the up with the good, down with the bad. Because that will enable the patient to do the function, but not necessarily to strengthen that leg.
Okay.
Okay, they're not ready at that stage. Okay, the squats. Okay, kind of like what we were showing earlier with the deadlift. Squats, they have to sit into it, right? Not this. The knees has to be behind the toes. Now, how wide? Shoulder width apart can be, right? The sumo squat is a little wider, but let's say shoulder width apart. Stick the butt. Okay, when in doubt, stick your butt out. Okay?
For sumo, so normal squat shoulder width apart. Sumo, would you just say just a half step wider, or maybe 2 half steps?
Yeah. I don't usually do that because it can be used as a shoulder width apart, and then they're going, and they have to be kind of sitting back. Sitting back, the toes you should feel like it's gonna come up.
Yeah.
Okay? When they're doing that, and then you can go with this. But you see the knees are still not too far in the front. Okay? They use their glutes a lot. When in doubt, stick your butt out.
When in doubt, use the butt.
Use the
That
Alright?
butt. Thank you,
So
okay, butt.
that's
No,
for the
but like
squats.
literally, that's why your butt is the biggest muscle.
That's why. Because
So you got three.
and
What?
then
Or the well, maxis, medius.
yes.
Oh yeah, minute,
Yeah,
minimum.
Okay, now the codmans. Codmans, they should not be using their arm. They cannot be doing this.
Like it's very
It's hard
tough.
to
It's hard to explain
It's
it to
hard
them.
to explain. I
But
tell
I say
them
like
use their hips. And I tell them like your arms are dead weight and use your
See, that,
hips.
you're
I say
basically
the
doing
same
a
thing,
lunge
but they still can't
They still
do
keep using it. Yep.
because they don't know how. Most of the time, the issue they have is they don't know how to relax.
They
Because
don't.
what you want is a complete like look, watch my shoulder. This is me normally trying this
Yes.
because I need to hold the weight up.
Mhm.
This is me completely dead weight. Like you
Yes.
can feel like because what we want is a joint distraction.
She was 10 pounds sitting.
Yeah, no, because you'll feel the joint distraction.
Yes.
Oh yeah.
Because most
Like,
people,
yeah, my shoulder.
most people cannot relax. Most people
No,
don't know
that's
how
me,
to.
like, as a-
When we're
relax.
when we're doing motion, they're lying
feel
down.
you
Relax,
feel that
relax, and you
gap
still
in
have the
the
arm like this.
So instructor.
I'm relaxed. No, because when I let go, the arm is still like
shoulder
this.
position.
Maybe I
Continence
did.
Yeah.
I was not relaxed. I should gonna put the.
Just wait,
No,
so stroke.
it's hard,
Yes.
right?
Okay.
Because
Yeah,
the
like
muscles
they're
are.
not allowing
You don't
me
want
to.
it.
And
Okay.
I was-
That's
That
because
is
they're
true.
rotating
And
the
it's
muscle.
tight, literally.
Oh.
So like you can feel that, right? It's real utterly relaxed. When I activate my rotator cuff, and
Yes.
bring it up,
Okay.
I don't like do a whole motion with it.
Yeah. No, I feel that. Yeah.
That's why
Alright.
it's easier with a heavy weight actually.
I thought you were.
Because
Sometimes
the
you were
heavier
but-
weight pulls it down more.
you can you can palpate that more
Yeah, and-
easily. But with the patient, then a lot of times you can't give them a 10
Relax
pound
on
weight.
the right. You can feel that gap is created, right?
Yes.
So that's what you joint distraction
Yes.
helps a lot.
That's synapse.
So for codmans, ideally shouldn't be just free weight or like that body weight all the time. They should be carrying.
Yeah, that's what I've been trying to bump. I'll usually bump them up.
Yep. So forward, back. Yep. Use your hips.
It's like you're doing
Side
a
to
lunge.
side.
Yeah, you can do a
Yep.
lunge. Like
Mhm.
completely relax
Yes.
your, yeah.
And usually the lunge will be a better position because if they're like this, it's hard. They won't be able to do it more relaxed because they need their arm to move. So lunge will allow them to swing the arm. All right. Kind of like so it's like bowling, and then you just throw it up. Okay. Now the side to side, it's even easier. The circle though, the picture is always says go inwards. I always go outwards. Why? Because most of the time the arm is in. You really don't see a lot of limited internal rotation when it comes to touching the belly. I usually want them to do more external rotation. So I tell them to go out. So when you see my patients doing codmans, it's always go
Always
out.
out. Okay.
Always.
I'll just do always out.
Yeah, because they'll be in a sling. They're always gonna be like this.
I think the
Okay.
kettlebell is better than the dumbbell.
Yes.
Okay.
Yes, it's easier to
Unless-
grab.
So So I think
Did you hold it? Did you hold it like this,
Yeah.
or did you hold it
I
like
did both.
this?
I did both.
Okay.
I did
think-
that for the circles.
I think this would be better for using dumbbells, but I think kettlebells are the best.
yeah, because like the kettlebell, like you can hold it in a secure
But that's the
grip,
thing,
but
some
the weight
people
is
can't do
all
5
underneath.
yet.
Yeah.
Yeah.
People can't do 5 yet, so then you have to use those weights.
Okay. So the cotton bunches, make sure they're not doing that.
Because oftentimes we just see them no.
Yeah. Yeah. And have them do a lunge position,
Okay.
split stance, because.
We're gonna head over.
Okay.
Mhm.
Yeah, we're finishing up. We'll see you over there in a
Sorry,
second.
finish up soon.
Do we just, you can't make a reservation there anyway, right?
We take up the seats already.
It's first come first serve.
Okay.
Yeah.
But then no, generally they do have like seats available, so it shouldn't be a problem.
Okay.
And yeah, we'll wrap up soon.
Yeah, we're gonna be finished soon. So now, with that one, yeah, if they don't do a split stance, it's gonna be hard for them to relax.
Okay.
So now this one's for the paddle first. So I tell them, okay, take up the slack, middle of your chest, like your sternum area, and then you make a step side.
Oh, middle of chest. Okay, that's
Yeah.
better than probably better than belly button.
Yeah, and it's too low.
Too low. Okay, so you want it
The
more
middle
up.
of the chest,
Okay.
right? And then they take the step to the side, right? And then they do a horse stance, we call it, like this, right? Bend the knee, hips, but not like this, okay? Do a horse stance like this, and then tighten your stomach, and then you tell them to extend the arm, and then coming in, okay? So,
You want to tuck the pelvis in, right?
stick with the out.
Oh, stick the butt up.
That's the out, the horse stance.
The horse stance.
This is the horse stance.
Yeah, you don't
When
want.
in doubt, stick your butt out.
Yeah, right? So from here, one
Stick your
step to the
One
side.
out na
Yeah.
ganon or
Enter
ganon?
pelvic toe.
Oh.
Yeah,
Also ganon.
yeah, that's what it is. So from here, and then I bring the stomach out, and then out, and then but you should feel this. Okay, with this one, I feel it. Okay? You should feel something. Right, pick up the
In the
slack.
arms by you. Do you feel it in the arms or?
Here.
Because I feel it in the arms. Because I have noodles.
Oh no, I see what you're saying. Definitely in the core. for
I
sure.
have
Because it's gonna make it turn.
But I
Right?
feel it in my stomach when I did do the belly button.
Like, and then,
You're not taking, yeah, so,
so
so
more
from here, yeah, you gotta pick up the slack already. Then you do that, so, yes.
I feel
right?
it in my
You
arms.
feel it in, oh, you're gonna feel some in your arms too, but you should feel something here because it's gonna make it turn. Okay?
Yeah. But mostly in the arms.
I guess I've never really like stopped and tried to like look at this one like functionally, but I mean it definitely makes sense. Like when you're here, you're far out, it wants to pull you that way, so you come this way.
The longer the lever arm, let's say for you, the
Wait,
harder
okay, so
it is. Because you
take
have
a
longer
step
lever
farther.
arm, you have a
I
larger
can't
pull.
go any further.
Okay, wait. That's where's your starting position? Okay, that's, yep, then your feet will be kind of close together at that. A little more, because you wanna pick up the slack. But you see, it's, yeah, there you go, that's where you're starting. Then you take a step to the side. Yep. Put your arm forward. Yep, there you go.
It's too
You see
hard.
it pulled you already, right?
Yeah.
And so your arm going like this.
Oh, because usually they don't start here. They
Yeah.
already start here and then
Yeah.
they go out.
Yes, but this is hard to control because let's say I start here. But how many times do I do this? It's very arbitrary.
Yeah.
From here, I take up the slack and that's why I put it in the sternum area. I take up the slack, right, keep together. So that way when I do this, it's more or less consistent. With any patient, each time they do it, it's more or less consistent. Okay? So that's, so they're not, because if they start from there, like, can be 2-3 steps. No, the PNF, what's the question with the PNF?
I guess let's well yeah, so we have
So do you, flexion,
D1?
anything
Alright.
flexion refers,
And
like,
Stella?
flexion and extension refers to the position of the shoulders.
Yes.
So anything flexion means it's up here. So you have D2 flexion, it means it's going out like that. D1 flexion means it's going in like that. And then so,
wait, in down like that?
so let's say I want you to do PNF D2 flexion. You're going from opposite hip across. Because it's all, D is diagonal. It's always going
It's
diagonal.
always diagonal movement.
And then so So if you want D1 flexion, you're here, you're going up like that. So
Oh, okay.
when you say you want D something extension, your arm is always down. So, but then it's kind of, it depends how they say it. I want you to do D1 flexion. So that means start at D1 extension
To flexion.
to flexion.
Okay. And then if you said D2 flexion, you're starting
from D1
D1
no, D2 extension
to
D2 flexion.
Okay.
And then so oftentimes you'll see that I'll have like bilateral D2, because this opens up the chest.
Bilateral D2.
And so for that
Then-
one, we're not rounding the back, right? No, we're
No.
hinging at the hips.
No.
Or
No,
not
you're
that
just,
straight.
you're standing straight,
Oh,
Standing
okay.
straight.
and then going up
And
like
don't
that.
make them arch like this. So
Okay,
just stand
well I gotta
straight.
correct. Who was the person that
Brandon?
So,
Who?
Brandon, is it Brandon or
No.
Joe.
Velma or?
Vilma. I gotta correct Vilma on
Because
that then.
what you want to do is, this is like a really good chest opener, especially with Parkinson's. What you'll see is that they'll have like, you know, that shrugged in shoulders and fascinating gait. So it gets worse by the fact that they're constantly
Oh,
going
and
forward
you
like
started
that.
from down there.
yeah.
Oh, okay. So that's way better.
So then that's why you want to have them open up their
Yeah.
chest.
And also with the PNF, they have a rotation on the forearm and the wrist. Okay. So
It's a lot
yes.
more complicated.
Yeah. So from here, it's gonna be up like this. I'm gonna snap this, but from here, it's gonna go up this way.
Oh, okay.
So
'Cause
the
like,
arms, we're from
It,
now.
it's a,
Okay.
the whole concept of PNF is it's supposed to be functional.
Yes.
It's supposed to be functional, so there's the whole component of the shoulder, the rotate, like the flexion, the extension, the rotation, abduction, adduction, flexion, extension, wrist, fingers.
So this
So,
is D2, right?
Generally, they have like terms for it. When you're doing this, you are grabbing a sword from your hip, you're bringing it out and up.
Wait, so what's the difference between D1 and D2?
This is basically
D,
D2.
D1 is this movement.
This
Okay.
is,
So then
Right.
bilateral.
So you're
D2
bending or are you
is-
going
So
straight up?
bilateral. Would you ever do bilateral D1
yes.
flexion? So from here.
You know,
also
you'd be
from
here.
Here.
And then
Yep,
down.
yep.
Down. Okay.
Down this way. If they're pulling something, yeah. Or they're actually
So
pulling
there's
something down.
pulling something down like that.
Yes.
Like if you
Oh,
read
that
into
thing.
it, it'll be all more functional. Like for example, you want to take your shirt off.
Don't we
Take
take
your
it
shirt
around
off.
like this?
Yeah, you use both
Right?
hands.
Yep.
You use
usually
both
do that,
hands. So
right?
you're both coming from D1, no,
Mhm.
D2 flexion, going straight into D. Yeah, so like that's like taking your shot off. You want to take off your earring, you're doing D1 flexion.
Like brushing your teeth.
Brushing your
Right.
teeth,
It's
this would be
this
D1
movement.
flexion.
D and then
So D1 flexion, then
So-
D2.
Like as I said, like flexion, always up, always up.
Yeah.
Extension, always down. So D1 is always going to be from here. D1 flexion,
So if you're
D1
doing
extension.
D1, you start up here and then you go down.
It depends on what you're aiming for. Because you can
So-
do, if you want flexion, you start from here and going up.
The name is where the direction you're going. So if you want D1 flexion, you start from extension
Going to
flexion.
flexion.
two flexion. So you can also get D1 extension.
Extension,
Oh.
start from
From
flexion
flexion, go
to
to
extension.
extension.
Oh,
The name
okay.
is where
Yeah.
you're going.
Now it makes
So
more
okay,
sense
that
now.
makes a lot of sense.
Alright?
So if
This
it's
is where you're
D1
going.
extension, that means you're going down.
Down.
D1
Oh,
flexion
I'm
is you're
so
going
totally
up.
gonna school this year.
Yes. Okay?
So totally gonna school that kid.
You are
I'm ready for you now.
I'm
That's
ready
D-
for your
this is
questions,
D1,
Miss Beer.
D2.
Because that,
So
so you'll see
flexion.
me like with,
Extension.
with
Okay?
with
Alright.
Nelly. Like I'll do the D2 flexion stretch with her because that at least is a good way to stretch open her arm because she really, because of how rigid it is, it won't like stretch. And like so PNF is a great way to stretch any sort of rigidity. So like any spasticity and rigidity, it's a good way to stretch because it'll like elongate those muscles in a type of stretch that is not just like
And a
it's
functional one.
functional, but then there's a whole concept behind it. Then.
Yeah, but, yeah, for them it's just,
No, the fact, I mean, just being
Make it
able to
simple.
explain that, you know, D1,
So it's all.
D2,
no,
I'm-
no,
No.
not necessarily D2.
Well-
The diagonal pattern is the 1 and 2.
oh, okay.
This is
This is like
flexion and this is
this
Okay,
is
extension.
so-
two. Any kind of movement in this way is two. This is one.
Yes, you just have to remember which one is 1, which one is 2. Now, when it comes to the flexion extension, so you remember, flexion is where the shoulder flexion is.
Mhm.
Shoulder flexion is up, shoulder extension is down. So you know flexion is gonna be somewhere up,
Okay.
either D1 or D2. It's just a matter of if D1 is this pattern,
Like-
D2 is this pattern.
If you're gonna read it in the chart, if it says like, generally I'll just use like bilateral D2 flexion.
Okay.
So what that means is I want you to start and extend D,
Extension.
Go
go
up
to
to
flexion.
Yeah.
Yeah, so the fact that I now
So-
know that like
That's
whatever it says at the end is what you want to end with.
With
With
the direction you're going.
So yeah, so like, if it says flexion, that means always start extension. If it says extension, always start flexion.
Yeah, because you can't go flexion and inflection,
Yeah. Okay.
right?
And then zip it side to side.
Side to side.
And
Side
then
to
you do
side.
the weight.
I know.
All right, I think that's the last one on the list here.
Yes.
Anything else?
Not that I have. Honestly, that was
Yeah,
very.
the simple one, the other.
Oh, I think like the bar
There we go.
squats with the bar,
Oh,
bar.
careful.
So do you just do squats with the bar behind your head?
Yes.
Yeah, we can.
So you kind of rested on those trap muscles.
Yep.
Same thing. And then.
Hey.
Now you have to do the one you get up and then.
Oh, power.
Oh,
Power clean. Love power.
yeah. That I don't practice that. That I can't teach you because I don't practice that. The clean and jerk.
Watch the Olympians do that. My oh my, they do like 500 pounds.
When you're doing that, don't bend this way. Alright? Don't bend from your hip.
Yeah,
Close.
that, yeah. Closer.
Yeah.
So
Yeah.
you bend this, don't bend forward. Yep, that's it.
I feel my upper back.
I don't do this as much because I'm tight here.
Oh, so to get.
Strains me a little bit, and also my neck go like this. I don't do it as much, but all right. I think we got those covered.
My
Yeah.
noodle arms have been revealed.
The other ones we'll teach them as we go. Okay.